MCD Global Health is a nonprofit organization incorporated in the state of Maine in the United States, committed to improving the health and well-being of people worldwide. For nearly 60 years, we've worked in all 50 states in the U.S. and in more than 50 countries across the globe, from Africa to Asia, and Latin America to South America. Our mission is sustainable and transformative, to improve health worldwide through enduring, high-quality, cost-effective, and universally accessible health solutions. We prioritize the people and communities who are underserved, hard to reach, or most vulnerable. Our strategies focus on community and country ownership, locally driven solutions, and building local capacity. We're proud to be a Category A Public Health Institute, certified by the National Network of Public Health Institutes, highlighting our expertise and experience to improve public health systems and initiatives in the U.S. We aspire to be a partner of choice, an internationally recognized leader, innovator, and trusted partner in applied cross-national public health solutions. In the complex landscape of global public health, we've joined forces with a wide range of public and private partners, amplifying our collective impact. In 2019, MCD and our partners were recognized by the U.S. Department of State with the P3 Impact Award for our outstanding public-private partnership in implementing the Bioko Island Malaria Elimination Project, a flagship initiative marking its 20th anniversary. MCD's expertise spans a broad spectrum, from communicable and non-communicable disease prevention and control to pandemic response and preparedness, reproductive, maternal, newborn, and child health, sanitation and hygiene, health system strengthening, public health workforce development, e-learning, and telehealth. In the United States, our work is led by Elizabeth Foley and Danielle Lauder, and implemented by more than 100 dedicated staff members. MCD has been a long-standing national leader in helping bring quality, responsive health to rural, underserved, and at-risk populations through the use of telehealth. Our telehealth work began in 1966 when we linked community hospitals in rural and island communities in Maine to Boston medical centers through an interactive satellite-based television system. Fast forward to today. For the past 12 years, we've been leading the Northeast Telehealth Resource Center, also known as NETRIC, funded by the U.S. Health Resources and Services Administration's Office for Advancement of Telehealth. NETRIC provides free expert technical assistance for the development of telehealth to health providers in New England and New York. A highly skilled public health workforce is vital to improving health and well-being worldwide. Over the last 50 years, we have helped maintain and grow Maine's public health workforce, and we've trained thousands of public health and healthcare workers, including physicians, nurses, community health workers, public health educators, and more. MCD has also been a hub for Project ECHO since 2018, supporting and delivering a broad variety of case-based learning programs to help address some of today's most challenging public health issues. Our Global E-Training and Technical Assistance Center serves more than 15,000 public health workers in all 50 U.S. states and 33 countries. Our e-training platform is a significant resource for educating community health workers, among other health professionals. In addition to offering full core competency training for community health workers, it also includes e-training on the management of chronic conditions such as high blood pressure, hypertension, prediabetes, asthma, and COVID-19, as well as emerging topics. MCD Global Health's work outside the U.S. is led by Dr. Josiah Ratsarason and implemented by more than 400 staff residing and working in nearly 20 countries. We're recognized as a global leader in public health initiatives such as sanitation and hygiene and malaria prevention and control, among others. For more than 40 years, MCD has been improving sanitation and hygiene in schools, healthcare facilities, and rural and peri-urban households, primarily in sub-Saharan Africa. Our approach is locally led and human-centered, ensuring we work in harmony with communities to improve sanitation and hygiene practices. We are a globally recognized leader in community-led total sanitation, an approach we've used to help nearly 30,000 villages in Madagascar and Benin to eliminate open defecation. With more than 240 million malaria cases worldwide, we at MCD have spent the past 40 years providing expert technical assistance to malaria control programs in more than 20 countries. We've increased public awareness of malaria transmission, prevention, and the importance of seeking timely, high-quality treatment. For 15 years, we've partnered with other organizations under the U.S. President's Malaria Initiative. We've led global malaria diagnostics and treatment efforts, participating in several major cooperative agreements to combat malaria. Under this USAID PMI initiative, we've pioneered an approach called OTSS, which stands for Outreach, Training, and Supportive Supervision for continuous quality improvement. We've developed competency-based curricula for laboratory staff, developed national malaria slide banks, co-authored the World Health Organization's Manual on Malaria Microscopy, and helped develop global malaria treatment guidelines. In 2022, we were awarded the Malaria Capacity Strengthening Cooperative Agreement by USAID Mozambique, where we're working to support the National Malaria Control Program in improving the quality of malaria services in 3 provinces of Mozambique. As we traverse the globe, we find ourselves at a place of extraordinary beauty, as well as challenging health issues: Bioko Island in Equatorial Guinea. It was here in 2004 that MCD and our partners launched the Bioko Island Malaria Control Project, now known as the Bioko Island Malaria Elimination Project, or BIMEP, a program that has become a beacon of hope and a model of public health intervention. In the 2 decades since its inception, BIMEP has fundamentally transformed the health landscape of Bioko Island. Malaria transmission has dropped dramatically. The island's children, once gravely threatened by the disease, now grow up with significantly lower risk. But BIMEP is more than just numbers and statistics. It's about the faces you see, the stories you hear. It's about families who no longer live under the constant threat of malaria. It's about children who can now dream of a future not overshadowed by disease. I remember when I was a little boy, I have seen children dying from malaria. Now, since the malaria program on Bioko has started, it's over. It's a completely different era. BIMEP is a testament to the power of collaboration, innovation, and relentless determination. It is a story of dedicated funders, project staff, health workers, volunteers, and community members, all united by a shared vision. BIMEP's 20th anniversary is not just a milestone. It's a stepping stone toward a world free from the grasp of malaria. It's a demonstration of what we can achieve when we dare to imagine a healthier world and work together relentlessly towards it. This is MCD Global Health's commitment and promise: transforming global health one community at a time. Join us and our partners from the public, private, and civil society sectors as we celebrate 20 years of BIMEP and look forward to a future where every person, no matter where they live, can lead a healthy, fulfilling life.